Well, good morning, everybody, and thanks so much for joining us. We're pleased this morning to have members of the Dao Labs practitioner community who are joining us to learn about Bao Hewan, the inspiration behind our Digestive Harmony formula, which is quite popular and quite powerful, and we think also tastes pretty good. So for those of you who are participating, if you've got questions, please feel free to submit them using the Zoom link at the email my help Tracy at mydaolabs.com, who's also going to be moderating behind the scenes this morning. I'm John McGarvey, of Labs, and with me this morning is my colleague, Dr. Eric Karchmer, who's our Chief Chinese Medicine Officer, Chief Doctor of Chinese Medicine, PhD, and also acupuncturist. And joining us this morning from office at Appalachian State University. Professor of anthropology, and he's fit this webinar in because he's got to run to the Boone Healing Arts Clinic in North Carolina, where he's got an afternoon of patients who will be treating. Just by way of background again, Eric spent over about 7 years in China studying traditional Chinese medicine, all in Chinese, and he's been a co-founder with us at Dao Labs for the last 4 or 5 years. I will remind everybody that this morning's podcast, the web is being recorded, and anything obviously that we talk about this morning has not been, as we say in the trade, has not been verified by the FDA, and so we're not going to make any claims that will treat, cure, or mitigate any diseases. And if you have questions on what we talked about this morning, we invite you to email us directly or talk to, from a consumer standpoint, your healthcare physician or practitioner as well. So with that in mind, we're going to talk about Bao Hewan, and then at the second part, I'll talk a little bit about some of the things that are going on at Dao Labs, and we'll go from there. So with further ado, let's take it away.
Welcome, everyone. Thanks, John, for that introduction. I'm Dr. Eric Karchmer, and I'm going to talk to you today about this well-known but very powerful formula. I'm going to go to our first slide, if I can figure out how to do that. There we go. I think this is a formula that probably most practitioners are going to learn about in their studies, but I don't know if it's fully appreciated for all that it can do. This formula dates back to, I think it's first recorded as in one of the works of Judanshi, so it's about 1,000 years old. It's great for just digestive health in general, which is why we call it digestive harmony. Classically in Chinese medicine, it's a formula to treat what's called food accumulation. I'm going to talk a little bit more about that. And the properties of the herbs are to reduce and guide that accumulation. And when we think about it in terms of Western medicine, we can equate that roughly to something like indigestion. In fact, I think indigestion is a pretty good equivalent of this idea of food accumulation, things not digesting, not descending. One of the key principles for treating digestion in Chinese medicine is this concept of harmonious descent. And that is sort of the goal of the stomach in Chinese medicine, is to make things descend and make them descend harmoniously. And it's when they're not descending, when things start going in the wrong direction, that we get into trouble. So that's our basic principle, and digestive harmony is a formula that can help you achieve that in many ways. And we're going to talk about a little bit more about why. So classically, when we study this formula, we learn that the cause of this particular pattern of disharmony is usually going to be two things. One, overindulging in rich foods, alcohol, somehow eating in a way that's eating too much or doing something too suddenly, as well as eating foods that are uncleaned or perhaps not been sitting out for too long, or those kinds of things. So those are the sorts of things that like set you up for indigestion or food accumulation, as we say in Chinese medicine. When food accumulates, when it stagnates, when it doesn't descend, when the stomach's not able to achieve harmonious descent, then we have some sort of obstruction to the qi mechanism, and things don't go down, and the things that should go down don't, and the things that should go up don't. As a result, we'll also probably have some dampness, perhaps some phlegm building up. And what you'll see in your patients in this situation is abdominal bloating, pain, reflux, belching, perhaps vomiting, also perhaps loose stools, and talk about those symptoms in a little bit more detail in just a moment. So those are the sorts of things you're probably going to encounter in your textbook. What does this mean in clinical practice? What does it mean for your patients? There's a few subtleties here that I think are important. One, if you're having patients with these sorts of complaints, I think it's always important to have a conversation with them about just sort of healthy eating habits and what that means from the perspective of Chinese medicine. So for anyone who's got digestive concerns, you're going to want to sort of educate them on what would be considered cold foods. Things that are cold are going to be challenging for the stomach. They're going to be hard for the stomach to digest. Cold foods are often going to be raw foods. You can think of this could be fruits or vegetables. A lot of melons and gourds are considered cold. But things in the brassica family, kale, cabbage, broccoli, those were all cold foods. So you're going to want to encourage you're going to want to have a discussion with your patients to, one, help them understand that those kinds of foods may be a little bit more challenging for their digestive system, and to help them recognize too that there's a difference here in sort of what's going to be good for the stomach and what we tend to think of as healthy foods as your sort of typical American consumer. So a raw salad, may not be the best thing for somebody who's really struggling with some digestive complaints. Another thing I always tell my patients too is to be careful about leftovers. So it's one thing to have some roasted broccoli or some steamed broccoli, that's just been cooked, but and that might be fine for your average patient with some stomach discomforts. But on day 2, day 3, it's really a very different thing. And I have to really have these long talks with my patients to say, leftovers, I understand how it works economically for like the family budget, but for the time being, you want really kind of fresh cooked foods. Let's talk now a little bit about how we use this formula. Food accumulation is a problem of excess, and so I'm going to two columns here. And one thing I hear from practitioners is that this is a great formula, but it's only good for patterns of excess. So literally, you've got food, dampness, these things that are accumulated, and some indigestion. So some practitioners will say to me, well, I probably only would want to use it for, just a day or two, or the moment when this patient is suffering from some of these more intense digestive complaints. But as a matter of kind of clinical realities, you typically are going to have a mix of deficiency and excess going on. So the folks who struggle with digestion the most are going to be the ones who've had ongoing problems for years. They've got some sort of chronic deficiency, probably a spleen qi deficiency that is then kind of working to get, or unfortunately sort of working together with the problem of food accumulation, so that these problems will then tend to kind of occur again and again. Digestive harmony is a great formula for these more acute cases of indigestion. Yes, wonderful. But it's also something that needs to be considered in more kind of ongoing chronic cases. In this situation, it can be extremely useful it may or may not be enough to kind of take care of the problem. And then depending on how deep, how persistent sort of these underlying deficiencies are, then you may need to combine it with some other formulas. But there's I think there's also maybe some misuse of these supplementing formulas, like gentleman's decoction, going on when folks have ongoing chronic digestive issues. To just use a supplementing formula like that may also be a mistake. And you'll see doctors in China being very cautious about using supplementing herbs with chronic gastritis or chronic digestive issues, because the supplementing herbs, or too much of supplementing herbs, are thought to contribute to sort of to the accumulations, the blockage, the obstructions, the dampness that are already going on in the middle burner. So you want to sort of, there's a balance here to strike with your patients who's got more chronic kinds of problems going on. Digestive harmony is, I think, a good place to start. See how they do. If it gives them relief, but the relief doesn't kind of last, or they don't seem to be able to kind of make the next step forward, then you might consider adding that next formula to something like 4 gentlemen's decoction, 6 gentlemen's decoction, to help them get to that next level. So let me just say a little bit about the formula, and that I think also helps us to understand what it does a little bit better. But you can break it down into really 2, maybe 3 parts. The first part is the part that does the reducing and the guiding. And so those are our herbs: hawthorn berry, massa fermentata, raffinus, and there's a little bit of sprouted barley, in here. And I've made a little note here on the slide. You can see each one of these herbs is also thought to treat different types of accumulations. So hawthorn berry specifically for like a food accumulation due to meat, whether it's unclean meat or too much. Massa fermentata related to alcohol, a food accumulation due to alcohol. The raffinus and spotted barley due to wheat. So you're kind of trying to hit sort of all your bases with these 3. And the hawthorn berry, by the way, is the chief ingredient. It's the biggest component in this formula. So that's very important. Because food accumulation leads to qi obstructions or qi constraint, and ultimately can lead to impair the movement of fluids. You often can get dampness and even phlegm in this condition. So there's another famous formula, 2-aged decoction, or archentang, is also a component of this formula. So that's tangerine peel, pinellia, poria. So these are great for digestion, for dealing with this problem of dampness that may occur with some impairment to digestion. And then lastly, there's some forsythia buds that are used to clear heat. So when things don't move, when things back up, that stagnation that can then turn into heat. So that's the reason behind that. It also has the ability to kind of break up sort of different kinds of clumping or accumulations or nodules. So it's kind of works on a couple of different levels. So what's this formula great for? So as I was just saying, the more common uses would be for, when you've overindulged, you've had a big night out on town, Thanksgiving dinner, you just couldn't resist, an extra glass of wine and 3 more servings of stuffing, or those sorts of things. So it's great for those kind of as needed moments. You can, you're probably going to get some better results with this than you would with your typical sort of antacids. It can be for more serious conditions, and I've used it this way myself, just trying to recover from sort of a food poisoning sort of event where you've gotten really sick and you've really been in bed for a couple of days, vomiting or vomiting with diarrhea. those kinds of things. And this is going to be a formula to help you bounce back from that. So it's great for these sort of short-term problems, but it does have these more long-term uses. And as I said, folks with chronic digestive problems, they will have probably some sort of underlying deficiency. And those folks can probably really benefit from being on this formula on a regular basis until they really start to see some improvement in their conditions. And the idea here is this is a formula that's going to help with the proper descent, the harmonious descent of food. And there's an expression you'll hear doctors, I've certainly heard many of my teachers in China say this, that to tonify through opening. So here the opening means to get things moving down. And by getting food moving down, getting the digestive system working properly, we achieve that ultimate sort of supplementation or tonification that had been sort of the cause of long-term stomach problems. So again, you need to kind of find a balance sometimes, and you have to see just how deep the deficiencies are, and is this enough? The digestive harmony alone may not be enough to do that, but it can be a very useful formula for these more chronic conditions. And in fact, you'd often see doctors using different pieces of this. They take it apart and put different pieces into sort of more complicated, more individualized formulas when they're writing like a bulk or a prescription for their patients in China. I want to talk about a couple of other less well-known uses. These are some things that I do in my practice, and I found it very helpful for these things. First, chronic eczema. This is I've been surprised at actually how useful it has been for chronic eczema. Sometimes I find myself, this is particularly with my kids, actually reaching for this formula because I have it around at the house. It's easy and they'll take it. Now we need to do another webinar entirely devoted to skin problems, and that's maybe coming in the future. But eczema has a number of causes, but one cause for kind of a chronic eczema condition would be some sort of, would be related to sort of a spleen and stomach disharmony. And when you find patients who've got chronic eczema, and in this case, it's going to be, it's not going to be the sort of intensely, well, it's going to be itchy, but it's not going to be intensely itchy and weepy sorts of patches of like an acute eczema, but it's going to be something that kind of goes on and flares up from time to time, but it's sort of pretty persistent for a lot of folks. And if you find these patients that have chronic eczema, but also ongoing digestive complaints, like something they've had poor digestion for years and years, this is a great formula that, although it's not quite necessarily the perfect formula, it may be just enough to kind of keep that eczema at bay. That's going to improve their digestion, and then and that's often at the root of these chronic eczema problems. And so this is definitely something to consider. So if you see eczema plus digestive complaints, this is definitely a useful formula. Insomnia. This is another thing to kind of keep in mind. We have at Dow Labs, we have two great sleep remedies that we sell that are totally different than from this formula. But there's a basic principle in Chinese medicine that when the stomach isn't settled, the spirit will not be sort of retained. And so a digestive, anyone who's struggling, and this is in some sense makes a lot of common sense too, anyone who's struggling with digestive issues often has trouble sleeping. And you can just imagine somebody with like a gastric reflux, even just lying down can be problematic for those folks. Probably this patient is going to be complaining to you first about their digestive issues and maybe second about insomnia. But this might, if insomnia is part of the problem, this may be a way to get to it. And another thing to consider too is that with the two other Dow Labs sleep remedies that we have, when digestive issues are more prominent with those patients, you may very well want to combine this formula with those other remedies. So mental tranquility treats spleen and heart qi deficiency. If there's a lot of digestive complaints, you might adding this in may be the key to kind of like really really being successful with that. Likewise, physical tranquility is treating a kidney and heart yin deficiency, but adding in this may be the key to sort of really treating the stomach and spleen, helping the communication between the heart and kidney, and getting the patient to that sort of next level, and that really sleeping better. So on its own or in combination with other formulas, this can be very useful. And then lastly, kids, everyone should just know that Bahuan is often used for all kinds of digestive issues for kids. Just sort of like your run-of-the-mill tummy ache kids, and kind of Chinese medicine pediatrics are thought to have a spleen qi deficiency almost by definition. They're very susceptible to digestive issues. They may themselves struggle with eczema. I have a son that does, and I often give him this particular formula both for the tummy ache and for the eczema. It's really great. You may also find that because kids are more susceptible to sort of injuries to the digestive system, to the spleen and stomach, you may also find that they see a fair amount of diarrhea in the stools with kids. That is also, in a sense, a food accumulation that may result from, it may just be brought on by a cold, your run-of-the-mill cold. So, but it ends up in kids with this problem of food accumulation. Using something like Baohuan is really the perfect solution for that kind of diarrhea. And so again, an extremely useful formula, I think, and we often don't fully appreciate all the different ways we can use it. So that's sort of, those are sort of a few of my tips for some less common uses of this formula. I think now we would turn to some questions and answers. And if we've put a few questions on the screen, I can talk about these, or just go straight to your questions. John, would you like me to address these questions first?
Are you able to hear me now?
Yep.
All right, great. Did get one email from a practitioner that wasn't able to attend this morning, asking about the use of Baohuan for treating IBS. Are you able to speak to that?
Yeah, I think it would be very, very useful. IBS. I think you're going to see a lot of these symptoms: bloating, belching. You're probably going to see some diarrhea. You may also see constipation. That's kind of the classic symptom. So I think it would be very useful. I've also found that our emotional balance, so Xiaoyao San, sometimes can be very useful as well for IBS. I think the key here would be to decide if there's really more of this emotional component to it. Is it stress and emotional? Is that sort of like kind of the key to, is that sort of at the root of these IBS symptoms, or is it something less connected to emotion, but more kind of pure, just sort of spleen and stomach disharmonies? And digestive harmony would be, I think would be certainly one of my top two considerations for dealing with that.
Thank you. And then somebody else had emailed us just to talk about dosing a little bit, and frequency. So if you could speak through that, that would be, I think, very helpful.
Yeah. So in our sachets, we've got basically 2.5 grams of sort of the kind of pure Chinese medicine granules. We work with a manufacturer who recommends that basically, and the dosing can be a little bit complicated, but I think the easiest way to think about it is the manufacturer recommends that your patients have anywhere from 6 to 8 grams of the granules themselves per day, and that's sort of a way to manage the dosing. Now, there's other elements in the sachet itself, so the sachet is going to weigh more than just the 2.5 grams, but the actual, take out the flavorings and things like that, that's 2.5 grams of the TCM granules. So that gives you, we chose that number just because it's both, I think, that's it's effective. That's enough to be effective on its own, but it also gives you the flexibility of maybe doing it even 3 times a day. So I would recommend for most patients to kind of start off with doing it twice a day, see how that goes, but potentially going up to 3 times a day, and you might have them plan on taking it in the morning and the evening, which is a kind of standard, but then have an extra packet on hand if, you know, something happens in the middle of the day and, you know, you eat something and a meal doesn't go well, or you eat the wrong thing, too much for your digestive system, and you maybe do that 3rd packet as needed.
If I could speak to that just for one quick second as well, because we do get a lot of questions both from the practitioner community and oftentimes their patients or just our consumers in general. This tends to be one of our most popular formulas of the formulas that we launched with. And you can read a lot more about what people are saying in our review section if you go to the product page on MyDal Labs. And so I think on the packaging itself, we talk about 1 to 2 packets on a daily basis, not to exceed 4. And so I think that despite the fact that it is in a sachet, I think the dosing is actually is pretty strong based on the feedback that we've gotten. And I think that extends to the purity of the herbs and the strength as well of the concentration. So,
there can be a lot of confusion about how, whether some people think we have far too little or far too or not nearly enough. But no, it's a very good amount for it's a proper dose, that's for sure. And I think, and depending on how bad the problem is and what's going on with the patient, just maybe 1 sachet a day is going to be enough, you know. But you could certainly go up to 2 and even 3, I think.
Great. And I was just handed a question. Somebody was inquiring about, is this more preventative or is this more something that is taken on the backside? And you spoke to that a little bit. So could you just kind of one more time just run through? Is this something that should be taken on an as-needed basis, or can this be taken for just general maintenance as well?
I think it's a little bit of both. And then it's going to depend on the particularities of each patient. But so if you're dealing with a patient who has struggled with digestive issues, this definitely could be this is definitely going to be a good formula to go to on a kind of to use in a sort of preventative manner. Now, I think with a patient like that, you're going to have complaints from time to time, and this could be something you might, in that situation, you might want to do it once a day. Perhaps once every other day, if the complaints are really sort of mild. And that can kind of just keep you on track. And you might do that for a number of weeks, even a couple of months. And at that point, maybe you're feeling really great and you don't need it anymore. So it'll kind of depend on the circumstances. Certainly you can do it, I think, as needed, you know, when something really flares up. I think that's great. But then I would say if that sort of thing is happening on a fairly regular basis, then there's some underlying issues here, and you want to address them. And I think doing it in a somewhat regular basis can be helpful in that sense of supplementing through opening. This is a formula that's going to open. You know, when you read kind of more technical descriptions of the formula, there's also cautions about taking it too much, and I think that's something to be aware of. You wouldn't want to abuse it either. You don't want to the formulas that are, you know, that reduce and guide. They're trying to like move things through the digestive system. So if you were to kind of do it too much, and you could potentially that could potentially lead to some problems. So there's a balance to strike. But on the whole, I think it's considered a mild formula and very safe. And I personally haven't seen any problems with overuse in my own clinical practice. So I think folks do pretty well on it. So I recommend.
Great. We're kind of beginning to bump up around our 30-minute promised end time. I will ask if you could indulge us for 1 second, Eric.
Sure.
Are there any particular acupuncture points that you, I wasn't going to let you get away without this. Are there any points that you like or you recommend when it comes to complementing the herbs, be they Bao Huan or the Four Gentlemen's, that you could speak to?
Yeah, for sure. There's a lot. I was going to try and get out of this because I'm bad with the numbers. I did my training was in Chinese, so I know all the points by their Chinese names, but not by their numbers, and I hadn't prepared those for you. But I'll tell you some things that I do and some a few things to kind of think about. Typically you're often thinking of kind of some distal points and some more local points in any treatment, really. So some of those more local points are going to be on the abdomen. Tianshu, and I'm sorry I can't give you the number here. Tianshu, which is 2 inches to the left and right of the belly button, is a wonderful point for kind of getting qi moving up and down. I like to do some of the points on the renmai. So Zhongwan, Shangwan, Jianli, and I'll often palpate right along the renmai and see what kind of tenderness I find. If you want to do a little, if you need a little bit of supplementation, something like Qi Hai, which is an inch and a half below the belly button, can be really great. And then for some more distal points, you could look at your spleen and stomach meridians. Sanli, which is that one I know, stomach 36, is of course a classic, and I would definitely use that. But I'd also palpate below it and see what sorts of tenderness and you have on the points below that as well, because those are also very useful points. That's Shang Jushu and Sha Jushu. I'm a big fan of, I think it's spleen 3 is actually, that's the number, would be Tai Bai. And I'll pair that with, so that's on the spleen meridian, and I'll pair that with some points on the lung meridian, because those are both on both Tai Yin meridians. And those are great points for dampness. So Chizi, and that's the one right at the elbow. I'm sorry, I forget that name. I forget that number, but on the some of the points on lung meridian could be great paired with a point or two on the spleen meridian, Tai Bai, but also San Yin Jiao, Yin Ning Quan, right up at the knee. Those are also great points for dealing with dampness. So I often do some palpation and see what I find. But those would be a good start, and then you want to again look to see what are some of the more complicated things that are going on. The advantage of some of the spleen and lung meridian points is that you might get some of the supplementation that you need to deal with the kind of these underlying deficiencies, and that might be a nice balance for Bao Huan, which doesn't give you, there's not much that's supplementing the formula. There's poria, but some of those, you can achieve some of that with the acupuncture, and then moxa would also be a great way to do that. Some, at least a heat lamp or some moxa on the stomach would also feel great for your patients.
Nice. Great.
Yeah.
Well, just some final thoughts. Number one, if people are listening either live or after the fact, and you have questions, go ahead and you can email either Stephanie, you can email hello@MyDao Labs, or Eric's email is like drkarchmer@mydaolabs.com. And you can email us, and we'll get them through to Eric and try to get the questions answered. The final thought I would have about the way we position Bao Huan, as you think about with your patients, and admittedly, I've got my sales and marketing cap on here, but I think that's important relative to the way that we've paired Bahawan with both orange and chai flavors. We just tweaked the formula a little bit in the last batch that we made, and I think your patients will be pleasantly surprised. And then, obviously, broadly thinking, the mission for all of us, but particularly with the way we're approaching Chinese medicine, is to make it much more approachable. And who doesn't have stomach issues in one form or another? And Eric covered a lot of different ways in which Bahawan can be applied to your patients in your community, and at the end of the day, it's a pretty effective formula. We've seen that with the feedback that we've received, and then obviously it's been around for over 1,000 years. So if you've got patients that are looking for an introduction to Chinese herbs, this is a really strong one, both from a flavor standpoint and then obviously from its effectiveness. We also obviously put it into a sachet so it can be taken on the go. So for your patients that are, let's say, business travelers or on planes regularly, this is one that we would really encourage you to recommend to them to keep in their suitcase, their purse, their briefcase, and whatnot, because it is pretty effective. And I would say finally, I can speak to both Eric's mom and certainly my mom as well, who you get those just those curious stomach sort of needs that creep up. And Eric talked through all the wonderful applications, but it's just also been one of those formulas that I think, for at least our parents, where you just can't quite put your finger on it, and it kind of does wonders. And that's very true. So with that in mind, we'll wrap up this morning's webinar. This will be posted to the resource room, and we're going to circulate it as well. So there'll be a replay and some notes that accompany it. But again, if you have questions, please let us know after the fact. And we thank everyone so much for listening to Eric's really great presentation this morning. So thank you.